Greeting of the day. I am Mr. Sandeep Arya, faculty of College of Nursing, UPUMS FI. Today we have an interesting and learning lecture entitled Publishing Journal Articles. For the present session, we have speaker Professor Dr. Shubhni Saraf. Dr. Shubhni Saraf ma'am is presently working as a professor and head in the Department of Pharmaceutical Sciences, Baba Sahab Bhimrao Ambedkar University, Lucknow. She has done PhD and M.Pharma degree. She has vast experience in the field of teaching and research. She has published more than 150 research papers in reputed international and national journals. And she has edited 2 books and wrote more than 12 book chapters. After brief introduction of today's speaker, let's start lecture entitled Publishing Journal Articles. Ma'am, kindly.
Thank you, Dr. Sandeep and Dr. Ankur Vaidya for giving me this opportunity to interact with you all today. So what I'm going to talk about today is publishing in journals or publishing journal articles. So what I'm given to understand is that today's topic is meant for pharmacy as well as clinicians who wish to publish. So I will be dealing with both the areas. So basically this is more about biomedical research that we are going to talk about today, and not just limited to pharmacy, which is my area of expertise. I will be trying to deal with a broader context of biomedical research of general interest. So coming to the first slide, research methodologies can be many. Sometimes we deal with a hardcore research where we are doing something that is done on a bench with a test tube. We are actually dealing in an experiment. Other times it could simply be a clinical study, or it could just be an observation which we have, which could be a single case study. So there are many different ways in which we classify research when it comes to writing, and there are two major ways we can classify publications. One can be a research paper and the other can be a review article. The others, of course, can be reports, they can be commentaries, they can be many other types of publication, they could be book chapters. But today I'm going to mainly deal in these two broad areas, which are research papers and review articles. So we're going to do those. So if we talk about research methodology, it could be descriptive or it could be simply analytic. It could be a survey based, where you have a cross section of society which you take, or cross section of subjects that you take, and whatever the outcome is, that gets reported. It could be qualitative research, where you do not deal in numbers, you simply describe. So, or it could be experimental, where you have your wet labs, you have experiments that give you some results, or they could be some observations that you have which get analyzed. So not going into too many details of the various types of researches that we have, because we are more concerned about publication as of today. So we move on. So our publication can be based on one of these various types of researches that we have done and the outcomes that we want. So coming to how we can make a topic search, how do we come to something new? So there are a number of these databases that we have which allow data searches. So it could be a patent search that we take, or it could be a research paper or a review article search that we make. But over here you can see that this is a Scopus search that was made, and a number of years that are given, and you can see that the number of papers that are given in front of each year, it was 41,000 something, then it becomes 44,000, then it becomes 45, then it becomes 47, and in the next year it is just the beginning of the year when this research is done, or this search is done rather, for documents, and a reasonable number of papers are already there. So what I want to tell you is that whenever you make a topic search and the number of articles is increasing, that means that you are dealing with a current hot topic, because more and more people are getting interested every year in this topic. whenever you find that this graph is in the reverse direction, wherever the number of papers that you get every year decreases, it means that your research already reached its peak, and now not many readers are interested in that research, or more, not many researchers are doing that kind of research. So this is the easiest way to find out whether you are dealing with a current topic. The numbers don't matter. They need not be in thousands or lakhs like the way it is in thousands. But what matters is that you need an upward trend. Every year, the number should be increasing. It could be a very small research area where the number of research documents that you would get when you make a topic search could be as small as 10, 15, 20, 25. But as long as the number is increasing, you are on the right track. So this is something that should be kept in mind the moment that we decide to start doing a research or doing, let us say, a thesis. It could be a dissertation, it could be a PhD thesis that we do. And the same holds good when we decide on a topic that we want to publish on. Now, naturally, this topic has to be a very broad topic. So going to the next slide. Let us say that the broad topic that was taken over here is solid lipid nanoparticles. So obviously you can see is that I have not bothered to put the entire title that I wish to publish on. All I have seen is whether, so this was a search which was done in 2016, but somehow I saved this slide and so I can share it today. So in 2012, 13, 14, 15, you can see that the number was rising, and then in 14 it peaks to 2811, and in 2015 it decreases to 1459. So this is where I want to make a point is that solid lipid nanoparticles somewhere around 2015 became an old topic, and then the next search, I mean, that should follow solid lipid nanoparticles is nanostructured lipid carriers, because they were the second generation of solid lipid nanoparticles. So what I just want to make very, very clear to you is that wherever you get some such trend where the peak is not in the year in which you are doing or in which you are publishing, then probably you need to make some modifications so that you get this kind of a peak. This search was made in Science Direct, or it can be done in Scopus, it could be done in PubMed. There are many different search engines. It could even be Google. So there are many different search engines which can be made use of, but these basics, in my opinion, remain the same. This will not be given in any book, but this is something which has been developed over the years while I have been publishing, to understand how you get to know whether what the topic that you have taken, is it current or not. So I hope that this is amply clear to the audience. Now going to the next step that we have, this is a literature review. So now, based on all this search that we do, whatever topic that we decide, once the topic is decided, you get such sort of a repository from any search engine that you use, where a number of articles are there. So in at the side of these, you get these boxes. So what you need to do is, all these boxes that you have, now there are also these journals that you are getting. So what you do is, whatever is important to you, just tick mark those. Then you limit your search to this. Like, let us say that I am only interested in advanced drug delivery reviews, I am only interested in International Journal of Pharmaceutics, I am not interested in biomaterials, because my area of research is not about material science. So if I'm not interested, I exclude out, I tick those articles and I exclude them out. So now what I get is a repository. Out of these, whatever is important to me, I click on those, and then I export them. When I click on export, I will get the options of taking it as a plain text. So when I take it as a plain text, I can save it. So I can just save the entire document into a Word document. And what I get is an offline library of whatever topic that I had decided to research on or write on. So where does this help me? This helps me in the literature review because I have already selected all the topics and I have taken their abstracts and I have saved all their references into one Word document. So all I did was Control A and then Control C and Control V. I pasted it into a document. Now this document could run into 40 pages, 50 pages, 100 pages, whatever it is. I have an offline library for my topic of research, which I can read at leisure. So I can do it on an iPad, I can do it anywhere. And from there, I can start highlighting what are the areas that are of my interest. So let us say that it is a method of preparation, or let us say that it is a clinical study dealing with X number of patients. So all the clinical studies that I get, what am I going to do? I will highlight them in yellow, let us say. And all these, I will separate them out and make a separate folder out of it so that I know that all the clinical studies are now in this place. Now, suppose I want something else. I want to know about the pharmacological activity of the molecule that I have taken for my clinical study. The next thing I do is all the molecules, the chemistry part of it, or the action relationship part, or the pharmacological action. Again, I make one more document where I paste this part, so it could be highlighted in red this time, all pasted together. So this is how you see that in a literature review, what are you doing? You are classifying and making different chapters of your work so that it becomes easy to deal with a lot of research that exists. So these days, because of internet, there is knowledge explosion. So any search word that you put and you will get thousands and thousands of papers. But finally, you have to limit your keywords. And so you can do this in Scopus, but then too a lot of literature will be thrown to you which may not be of your interest. So this is how you screen through these and make different chapters or different classifications which are of your interest. Now, what we are doing here, we are doing a literature review. From this literature review, there are two things that we can do when we talk about publication. One is that we can support our own hypothesis in a research paper where we already have wet lab results and we want to write a research paper. The other thing that we can do from a literature review is we can write a review article which simply deals with all of the work that has been done till date by various workers. And of course, we can also identify gaps. That what are the gaps? What is the hypothesis that has not been given so far? So a literature review helps us not just as a summary of literature, it supports our hypothesis in our research paper. It extends the previous work that has been done. It avoids the previous mistakes that have been reported by other researchers. And it allows us to become unique, that whatever has not been done ever before, what has not been reported ever before, we are able to identify that through a literature review. Now, coming to another type of review, which is very interesting to clinicians, especially and doctors, is systematic review. So, the basic difference between literature review and systematic review is that in a literature review, we are mostly dealing with theories, whereas in a systematic review, we are mostly dealing with data. So this is a lot of data that has already been reported and we are analyzing it in our own way and we are giving it as a systematic review. Whereas in a literature review, we are looking at a lot of content and the various theories that have been put forward and how we can classify these. So probably a very good way of classifying in a literature review is in the form of a table where you have various different titles or headings that you put into your table, and the last row that you have could be the references. That means that 4 or 5 people have worked on this particular drug, let us say. So you write comma 1 2 3 4 5, all of that comes, that means that 5 papers you have been able to put into one row. That is how you have successfully dealt with a lot of literature being summarized. And that is the beauty of a literature review. So normally when you write a literature review, you should try to aim at least minimum 150 papers. 150 papers put together will make a good literature review. And 150, if you start writing about each paper, it will become a lot. So the best way of summarizing these 150 papers that you have gone through is to make a table and summarize them, where even these entire 150 can be put together in just one table. So basically whatever you found in every paper, you need to classify it and make it into a literature review. So a literature review will generally address a question or a general topic, or sometimes a specific question. It could be in any discipline, not just limited to clinicians, or not just limited to health science. It could be social science, it could be anywhere that a literature review is done. But whereas in the case of a systematic review, we are always talking about analytical methods, we are talking about some statistics that we have applied, and we are, because this is not primary data, this is not our own experiment, these are things which have already been reported. But let us say that during corona, a lot of people reported headaches. Now we want to classify this, that how many people reported headaches. So you take all this data which has already been reported, this is secondary data because this is not your own experiment, but you analyze it and give it that x and y could be the reason why has it happened. So normally you are providing high quality evidence reported by various people, so it is secondary data, but you have a very clearly defined question that you are dealing with. And this is normally only for the biomedical and the healthcare sectors that we deal with systematic reviews. So I hope that the difference between a literature review and a systematic review, and also the difference between a review article, a general review article, and a systematic review article is clear to you. Moving on to our next slide. Now there are a number of software tools that are available for conducting systematic reviews. So especially for biomedical research, we do need to know what are the tools that are available. A lot of these, they are simply software that you can use, and with the help of this, a lot of data can get analyzed and you can be presenting it in the form of a systematic review. So like Rayan QCRI, this is 100% free web application to help people with systematic reviews. And so this is one, but there are so many. Covidence is a very popular one. There are many others like SysRev. This is a platform. Many of these are subscription model based. So wherever you have a medical university, what should be tried is that some of these tools are available so that it helps the researchers, because normally when you're dealing with nurses or pharmacists or clinicians, doctors, what happens is that you already have a lot of on the job thing to do, and research becomes secondary. But it is important that every time you see something in front of you which you feel that the entire healthcare fraternity is going to benefit from your experience, you must report it, you must write it down. So to do all this, now you have a number of software tools which can help you, and no longer it is how it used to be earlier, where you had to spend a lot of time with pen and paper and write and rewrite and review your manuscript. Now because of these tools, many things become easy. And so definitely you should get hands on, you should get very familiar with these software tools that can be utilized for systematic reviews. Now, once you have done all of that, what you should do is to make an outline. You should make a story. How are you going to link the various parts of your manuscript? So, of course, first you will have either the introduction or an overview of whatever you want to do. Then you will have your research question, or if it is a review article, you may not have a research question. And in your overview or your introduction, you have already dealt with whatever you are going to do. Then in your research paper, you will have certain aims and objectives. These aim and objectives will come just before your research methods. How have you done this? Whether it was a systematic review or whether it was a research that you have done, just before that you will put your objectives. And what you're going to do at the end of the paper is you will make sure that whatever objectives that you set out at the beginning, they have been met. So point by point, at the end of your research paper or your review article, you will make sure that whatever you wrote over there initially, that this is what I want to do, have you achieved it at the end or not? Because if anything goes missing over here, that in the objective you said, I wanted to do this, but in the end you came up with something new, then there is a disconnect and probably your paper may not get published. So make sure that whatever your aims and objectives are, they have been dealt with. Okay, now whenever you do this, prioritize your content, that what all is important, create a continuity, one section should always lead to the other. And another important thing is use a referencing software, because it may not be always that the first time that you communicate a research article it gets accepted. So the second time that you have to do it and you have to do the referencing again, it becomes a very tedious task. So what you need to do is to get hands on with a referencing software. It's very easy to use, it's not a difficult task. It's always the first time when you deal with something new that you feel that fear that I may not be able to do it and I'm not technologically competent enough, etc. But the moment you deal with it, like computers, now these have become such a common thing that you find grandmothers at home on YouTube. So obviously, why? Because these are very, very user friendly that you have, and because they are so user friendly, anybody can be using it. So similarly, in a referencing software, you can very easily use it, not really rocket science, anybody can do it. So what you need to do is, after you have done all of this, you need to make sure that your story is logical. One thing is leading to the other. Once you have all this in mind, you have all the sections that you want, all you need to do is to fill up these sections with all the relevant data and the details that you have. So this is the first thing that you need to do. Now the second thing is that you need to be ethical and you need to be original. The moment that you are not original, so if you have these 10 papers in front of you and you are referring to them, automatically your language, I mean the words that you get in your mind are the ones that they are there in front of you. So I'd always tell my students who write manuscripts that after you have finished reading, please put it away and then write in your own language, even if the English is not proper, even if the sentences are not proper, at least the broad features of whatever you want to communicate will come into one place. These can always get refined later. So this is one way in which you can be original, that just make the main headings, then put in whatever you want to in whatever language you want to, and this can always be refined later. uh, so coming to the referencing softwares that you have, EndNote is a very good referencing software that exists. So this can be made use of. Over here, you can download your references and make one database. So let us say that these were 50 papers that you consulted in making your research paper, or making whatever type of article, review article that you are writing. Save all these references and make a database in some such referencing. Make this bibliography, choose the citation sites. Then you can even collaborate, like let us say me and my research student, if we want to collaborate online with EndNote, we can do it. They can also add on whatever references that they want. I can also do it, and together make a library. Then we select what kind of a style do we want. So every research journal has its own style of referencing. Choose that from there, and simply every time that you include 1, 2, 3 at the end of your manuscript, the referencing that you want starts coming automatically. So you do not have to even worry about whether you have included the reference or not. जहाँ पे भी आपको पता है कि yes, this work was taken from this paper, just select that paper, and that's it. It automatically gets. So this is how in an EndNote I can insert a citation. I can select the style, and then automatically I will get it. So this is the kind of a library that I have, and I have selected that this is the reference that I want. And once I have selected, it starts coming at the end of the paper where I want. So this is how you use a software. Now, Mendeley is another tool that can be utilized. So, if you do not have a referencing software like EndNote, you can use Mendeley. Also serves almost the same purpose. You can over here also have your own library, your own references, which can be included. You can import these citations or references from Google Scholar or PubMed or Scopus and include them in Mendeley. So even if you do not have the paid version, you can work with the freeware that we have. So over here you can see that in Google, from Google, some references are being taken and they are being included into Mendeley. So whatever was ticked over here, that has been now added as a reference into Mendeley. So these are also important methods. Now next, coming to the various plagiarism checking softwares that we have. So there is this CheckerX, which is there, which is a freeware that can be utilized. Now you have these even in PubMed, because PubMed is very popular with Clinatial. So over here you have a citation manager option wherever you want to save. So over here you can see that these are the various papers that have been ticked, and choose destination. If I want to choose, select them and save them in a file or as a collection, or I can choose as a citation manager. It will go over there and it will create a file which I can use later on when I am writing a research paper. Now, as Indians, all of us naturally are not expected to be very fluent in English. It is not our mother tongue, and it is not something to feel embarrassed of at all. Because what is it? It's just another language. And probably if we ask somebody outside of India to talk Hindi fluently, how well will they be able to do it? So there's nothing to be embarrassed about. But the good part is that many of us have a working knowledge of English, and we can refine it further by using tools like Grammarly. Grammarly is available as a freeware, and you can also take the professional version personally, and it's not very expensive. So in a very small amount, you can take 1 year subscription. So normally if there is a research guide who has, let us say, 8 students working under the person, then the research guide can take Grammarly and it will be benefiting all your students and all their work that they are doing. So over there you get options for grammar editing, and you choose which is the right option that you want. And of course you also have your MS Word, which is not bad at all. It also gives you spell checks, it gives you options of thesaurus, language editing, synonyms which you can substitute. So all this you can do, but mostly you should not use very flowery or Shakespeare's English when you are writing a research paper or a review article. You should use very simple language just to get your idea across, because sometimes in your mind the idea may be very clear, but you will not be able to get the idea across if it is in a very complex language. So try to make your language very, very simple. Now coming to the author listing, whoever has done the work, basically the person who has worked in the lab, needs to be the first author. The communicating or the corresponding author needs to be the guide who has helped you formulate all what you have done. And if any other person who has actually contributed comes in between. So this is the sequence that needs to be followed. A guide or a mentor should never feel that their name should come first, because they are getting equal weightage as the corresponding author. And so that credit you should never take from your students. Let them be the first author, you be the corresponding author, and everybody else can come in between. So this is how author listing should be done. Sequence, normally the first author is the person who is doing the work. The corresponding author, it could be in order of seniority, it could be in order of the person's contribution to the work. So let us say that somebody contributed a lot, that person's name will come second, and then third, and then fourth. The person who's done the least may be the last. And after that, if you have the name of the corresponding author, there is always a star on top of the corresponding author, and you mention the name and address of the corresponding author. So that is why this is the sequence that should be followed. So it could either be seniority, where you have juniors and then seniors, or it can be in the order of the major contribution that has been made. Mostly the major contribution should be the way that you put the names in the sequence in a research paper. Now this is one phenomena, selective amnesia that people have. They finish the work at one institution, normally it is their place where they've got their degrees from, and the moment they move into another organization, there is a new boss, they want to please the boss, they will forget their guide, they will forget whoever they were associated with, they will put some more new names over there just to please somebody who has not even contributed at all to this paper. So I think that such type of selective amnesia is not ethical, it should not be the case. If at all there is some new contribution from your new workplace, you can always extend this work and make it a collaborative thing, but never forget to include the people who have actually worked with you on your manuscript. So surprisingly, internet, it's very easy to communicate, it's very easy to publish if you want, you don't have to pay a thing, and you can submit a paper to a journal. But the unethical practices are also rising with the internet, that you try to take data from somewhere, fudge it up, make it into some new plus and minus 2 in all the data and give it. So these are something which anywhere, the moment you see it's happening, definitely put a stop or try, say something, intervene, because together only we can do it. Plagiarism I'm not going to talk about because it's already been talked about, but you do have a number of software which you can make use of, like Turnitin or Authenticate, which are there. Urkund is one which has been normally a freeware and it's given to Indian universities, but the database that is there in Urkund for finding out the degree of plagiarism or similarity is not so good. So preferably we should use Turnitin or Authenticate and check the degree of plagiarism. Now another thing I want to share with you, that UGC has come up with a promotion of academic integrity and prevention of plagiarism for higher education's regulation. So this is a law that is there in the country which should be followed, and where you have these academic integrity panels. So please make sure that you have always subjected your manuscript to a plagiarism check before you publish. Now, there are also post-publication discussions and corrections. There is a site called PubPeer. I'm not very sure how many times that whatever they say is correct or wrong, but definitely they do behave like moral police. So sometimes, when your students are doing the experiments, you don't really know whether the data that they are giving you, how authentic it is, because after all, you are not the person who is standing on the bench and doing the work. So what you should do within your group is, at the whoever is giving the data, please take a certificate from them that they vouch for all the data that they are giving. This will help to safeguard, if at all in future there is some problem that happens or some data that there is integrity issue with, at least you are sure that you were the guide, you talked about the basic theories, the proposed mechanisms, the hypotheses, but the bench work was done by X, and X vouches for this data. So they can be X, Y, and Z. They can be three different people working at three different places, each vouching for their own data, that they were the ones who gave this data, so that you do not have any future problems. So based on all this experience of mine, I have formulated 10 commandments. I did it very long ago, but since the topic is somewhat like that, very quickly I will go through these 10 commandments. Always publish your own work, honor every team member, always acknowledge every source by honest referencing, do not copy even a few words or lines, and if you have to, it has to be in inverted commas, and you have to give the reference. Understand the concepts of copyright and plagiarism, intellectual property before you publish. Then even tables and pictures and figures, they need to be acknowledged. So you need to acknowledge them from where you have taken. If you have taken software in making your figures, acknowledge that software, that I used this to make my figures or this to make my tables, because that also is something which you are using. So you should acknowledge that. Always acknowledge the funding source. Then never send the same study to two different sources for publication at the same time, because this could also lead to huge problems. Never try to pass off manipulated or fraudulent data. Never conceal research findings. Many times you get negative results, but negative results is also research. So don't be shy if the graph, it should have been like this but it's the opposite direction. Report it so that any other person does not have to go through the same set of experiments again. So you also have journal of negative findings or journal of negative research. So wherever you have negative findings, please write a paper about that and publish it, so that somebody else does not have to repeat all of this, because after all it is a waste of manpower. So coming to the end of this lecture of mine, there is a moral of this entire story. Character precedes conduct, because who we are determines what we do. So just be very ethical when you publish, and I'm sure that India has a very bright future. So on this note, thank you very much for giving me this opportunity, and if at all there are some questions, I can deal with